Your dog won't stop licking their paws. At first, you ignore it. Then you notice it's constant. Then you see redness, maybe swelling, maybe even hair loss. Now you're wondering, is this normal grooming or is something wrong? Excessive paw licking is one of the most common reasons dog owners visit the vet, and the causes range from mild irritation to allergies to anxiety to infections to something more serious. In this video, we're going to break down exactly why dogs lick their paws, how to tell the difference between normal and abnormal behavior, and what you should actually do about it. Dogs naturally groom themselves. Occasional licking, especially after walks or before sleeping, is completely normal. Think of it as your dog cleaning dirt, dust, or small irritations. But excessive licking looks different. When licking happens multiple times per hour, interrupts sleep, causes redness or inflamed skin, dark staining on fur from saliva, hair thinning, bald spots, swollen paws, or even limping. That's no longer simple grooming. When licking becomes repetitive and hard to interrupt, something is driving it. The most common reason dogs excessively lick their paws is allergies, but not the kind most people think. Dogs don't usually show allergies through sneezing like humans do. Instead, their allergies often show up through the skin, and paws are one of the first places affected. Environmental allergies, also called atopy, include grass, pollen, mold, and dust mites. When your dog walks outside, allergens collect on their paws, leading to itching, irritation, and inflammation. You may notice licking after walks, redness between the toes, scratching elsewhere on the body, or recurring ear infections. If symptoms worsen during certain seasons, environmental allergies are likely the cause. Food allergies are less common than environmental ones, but they do occur. Common triggers include chicken, beef, dairy, and wheat. Signs can include chronic paw licking, repeated ear infections, digestive upset, and ongoing itchy skin. Unlike environmental allergies, food allergy symptoms usually remain consistent throughout the year, rather than changing with seasons. Contact irritation is another possibility. Winter salt, lawn chemicals, or cleaning products on floors can irritate your dog's paws. Sometimes your dog isn't allergic at all, just irritated. Simply wiping and rinsing paws after walks can significantly reduce symptoms in these cases. Excess licking can also create moisture, and moisture creates the perfect environment for yeast and bacteria. Once an infection starts, licking increases even more, creating a cycle. Signs of infection include a strong odor, brown discharge between the toes, swelling, thickened skin, and dark red coloring. Yeast infections often produce a musty smell, while bacterial infections may cause pus or open sores. At this stage, it's no longer something to monitor casually. It requires proper veterinary treatment. Not all paw licking is physical. Sometimes it's psychological. Dogs under stress may develop repetitive behaviors, similar to humans biting their nails. Triggers can include separation anxiety, lack of stimulation, sudden routine changes, new pets or people in the home, or loud environments. Compulsive licking often happens when the dog is alone, during nighttime, or after a stressful event. If the skin appears mostly normal, but the licking persists, anxiety may be the root cause. Sometimes dogs lick their paws because of pain located elsewhere in the body. Arthritis, hip problems, or nerve pain can cause dogs to lick the area closest to discomfort. You might notice that your dog focuses on one paw more than the others, shows stiffness when standing, moves more slowly, or hesitates to jump. Pain-based licking requires a proper diagnosis, as treating the symptom alone won't solve the underlying issue. Parasites are another potential cause. Fleas don't just cause scratching along the back, they can also irritate the paws. Even a small number of flea bites can trigger intense itching in sensitive dogs. You may notice small black specks known as flea dirt, red bumps, or sudden onset itching. Parasites are often easier to rule out compared to other causes. You should contact your vet if licking causes open wounds, noticeable swelling, limping, sudden behavioral changes, or lethargy. The earlier you address the issue, the easier it usually is to treat. In the meantime, there are practical steps you can take. Check your dog's paws daily. Rinse paws after walks and dry them thoroughly. Keep fur trimmed between the pads. Avoid using over-the-counter creams without veterinary guidance. Do not wrap paws tightly, apply human ointments, or ignore symptoms that continue to worsen. Long-term prevention depends on the root cause. Management strategies may include allergy testing, elimination diet trials, omega-3 supplementation, prescription medications, anxiety reduction plans, and increased mental stimulation. Consistency matters more than quick fixes. Paw licking is not random behavior, it's communication. It's your dog's way of saying something is irritating me, something is uncomfortable, something feels wrong. The key is observation, not panic. Occasional licking is normal. Constant, repetitive, or damaging licking is not. Your dog cannot explain symptoms in words, but their behavior always leaves clues. And the sooner you learn to read those clues, the better the outcome for your dog. If you found this helpful, subscribe to Paws and Whiskers for evidence-based pet behavior insights every week.